Thank you, Minister Morris, and certainly thank you, Minister Lake. It's an absolute pleasure to be back in Prince George. It's a community I'm getting to see more of in my travels as President. In fact, I'm getting to see a lot of this very vast province that we live in. The establishment of a UBC chair in rural health, led by British Columbia's rural physicians, has been a development with UBC, the Ministry of Health, the health authorities, and certainly doctors of BC for a number of years now. I particularly do want to thank Minister Lake for both embracing and championing this particular cause. You know, Minister, you were kind enough to invite us into the legislature to discuss this particular issue, an issue that's been on the minds of rural doctors for a long, long time. And we're really, really proud of the fact that you've been able to bring rural health forward in the manner and capacity that you have done. So Terry, thank you so much for your hard work and effort. I truly do believe, as we stand gathered here today, that when we reflect back on in our lives later on, we're truly going to see that a legacy was created in this room through the construct of partnerships that we have across the domains that we've talked about. So I stand here before you today and I say, you know, we have a foundation and we need to think about how we train young minds in medicine. Being a rural doctor has many, many rewards. Yet, as most of us in this room will know, there are also significant challenges that come from being a rural physician working in rural parts of the province. So I believe it's really, really important to train our doctors of tomorrow to help them cultivate an interest in rural medicine very early on, and when they do show that interest, to provide them with the skills and the training that is necessary to go out and have a very successful career in a rural community. At the Joint Standing Committee on Rural Issues, we have a number of very robust programs that support the recruitment and retention of rural doctors. Yet we needed to also look and seek a system of transformation that would help us address a stronger relationship with the university, with UBC, and the values and the foundation that revolve around rural research. The idea of establishing a UBC chair of rural health came from the rural doctors of this province themselves. And as a rural physician, I am incredibly proud of my physician colleagues. I am a career rural doctor, and I know that many of my rural colleagues, myself included, had very noble notions, not fully formed and informed by life when we finished medical school. And as we were fresh out of medical school, we started careers that we knew could be very promising. We imagined how we were going to go to work, how we were going to live, and most importantly, how we were going to attempt to balance our professional and our personal lives. However, once we engaged the service and work in our rural communities, those notions were quickly dispensed. You become part of the social fabric, but your service in the community extends way beyond your community practice. It extends into the hospital, the emergency department, and many other domains. So rural doctors know that our medical schools and our communities are the best place to start to give our educators and developing doctors a very realistic and informed rural framework. And I believe, Dave, as our new chair, you will provide that academic leadership that creates very, very strong linkages between rural doctors, their communities, and our university, and, for that fact, our Ministry of Health. Equally important will be the chair's mandates to conduct research on rural population health, and specifically as it relates to our populations here in British Columbia. That is the legacy that I believe we're building here today. Ultimately, we want to achieve an improved long-term healthcare outcomes for BC's rural populations and enhanced supports for the dedicated team of healthcare providers that extend way beyond the doctors in order that they can best serve our citizens. In large parts, I believe we've made a determined effort, and this will be accomplished by bringing together our collective voices through the university in this province that we're so proud of. I want to congratulate all of the partners today that have helped achieve this, and again I want to reflect on the gargantuan efforts of our minister in being able to embrace my request, the request of rural doctors, to bring us into the legislature and really explore what the opportunities are about truly embracing the rural fabric of this province. So together I believe we are working towards meaningful change. I really believe and I look forward to a very strong partnership, Minister, with the Ministry of Health, not just now but for the future. And Terry, I truly thank you on behalf of all of BC's rural doctors for the great work that you've done. Thank you very, very much.